Hello, Pain Free for Life members, and welcome to another Monday 10-minute training. I'm Dr. Rob Van Bergen, and today I'm going to be talking about conductive pad placement. Now, this is a topic that can be really left up to interpretation, but the honest truth is that there are some specific rules that we should follow when using conductive pads. And, the kind of like when should we, why would we want to, what's the better choice does have to come into play here. Now, for this particular presentation, I made a little PowerPoint slideshow, which I think is going to help kind of demonstrate some of the more specific things. So just going to get started on this one right here. So hopefully you can still see me okay and hear me. I believe you can. But essentially what we're going to be doing is running through this and seeing where we go. So conductive pads are something that we've been using for a very long time, but not something that is typical with microcurrent devices of our caliber. So typically we'll use probes like the Y electrode instead of conductive pads. And this tends to be better for us. This is why we have this difference between passive and active treatment. And you know what? I do not like, we're going to just have a smaller presentation because I don't like not being able to see myself. Makes me uncomfortable. So passive versus active treatment is something that we should really understand early on. So active treatment is the use of electrodes like the Y electrode that I just mentioned, or even the electrode on the back of your device that essentially enables you to move the device across the skin, aiding in the elimination of active zones. Passive treatment involves the use of things like the conductive pads to put current into the tissue and potentially, in some cases, to contract and manipulate muscle groups. Active treatment, due to the elimination of active zones, is one of the best things you can do and should always be a part of your treatment. So even if you're planning on using pads, before you use the pads, treat the area with your electrode so that you're able to get rid of any active zones before you move on to the pads component. Passive treatment with pads is useful in cases in which we cannot reach an area, for example, back pain, or if we need to deliver current for a certain extended period of time. That can also play a bit of a role there too. So, just going to go on to the next slide here. Pad placement is something that I always get asked about, but it's not supposed to be complicated, really. It's just not something that we instruct heavily on because we typically have used this active treatment method for so long. But the conductive pads, again, they have their advantages. Now, in most cases, but not all cases, conductive pads come in pairs or they come in sets. You see, you get your set of 4 regular pads here. Well, you can't use just one pad at once. You have to use 2 pads. So these essentially are going to use your red and your black lead wire, a positive and a negative connection, so a split. And you need to have both if you want the pads to work. Now, this sort of typical pad placement with 2 covers your basic pads like the standard 2x2, the 3x5s, even the trigeminal nerve pads. And if only one of these pads is plugged in, it's not going to work. You need to have the other side plugged in for it to work. We then also have single pads, such as the lower back, the low back right here, the vagus nerve, and even the third eye pad. Now, in these cases, even though they are one pad, they still require, as you'll notice, 2. They need 2 wires in order to make them work. So just like a regular pad, they function in that same way. You've got your 2 wire connections here. But the only way the reason there's a difference is, as you'll see, there's a split. So one goes to each side, but the pad is one cohesive unit. Now, when it comes to your pairs of pads, what you want to do is you want to try to keep them at least an inch, ideally 2 inches away from each other. And essentially, in my experience, because I get asked this question a lot as well, placement of colors of wires, like which side should be red, which side should be black, does not seem to make a functional difference. In fact, since you're kind of using these like they were TENS pads, bearing in mind that a TENS unit doesn't even normally have color differences in the wires, so it would be impossible for you to tell. The current is there. It is creating and completing the circuit in the body. So the standard pads, which are shown here, and the 3x5 pads are probably the most commonly used pad sizes. These are your standard pads. Typically, you place one pad on the area of pain or discomfort and the other one's 2 inches away. Let me give you a little bit of a brief demo on that here. So just use my arm as an example because it's something that's there. Let's say my wrist is hurting. Well, I'll take one pad. I'll put it right where the pain is. And then the other pad, I'm going to want to place a couple of inches away so that it has a pair, but there's enough of ability for it to travel. So I will place it at least here, sometimes even further down here. Now, I would connect both wires to the device, and I'm aiming to treat this, but I need to create a circuit. And so the electricity will be passing through the wires, but also through my skin to finish that circuit. You see what I mean? So we're going to end up with essentially a circle, and the pads are going to be working in that way. Now, the only exception to this really is if you are trying to improve circulation. So in the case of circulation improvement, to say the hands or the feet, you want to place one pad on the palm of the hand or sole of the foot and the other near the shoulder on the front of the body or near the groin for the leg. So I can't really stick it on my sweater here, but if I was trying to improve my my circulation, what I might do is place a pad. So say I have cold hands, I have Raynaud's syndrome, so my hands are always really cold. I'm going to need to be bringing in blood flow from somewhere that has more circulation. So I would, in this case, palm and then put the other pad here on the front of my body. So it's a big, long circuit, but the goal is that I'm going to be running that current right through my arm to my hand, through the wires and back as we go. So hopefully that clears up standard pad placement. There's a little bit more to it. I'm just going to get these off of me. Put them back on that little pad there. Okay, back to the slides we go. So those are your standard pads. Now, the trigeminal pads, these are used for more than just treatment of the trigeminal nerve. This is just how they got their name. The main purpose of these pads is to perform the PTSD and depression protocol, but these also work really well for joints and other smaller areas too. So these pads, like in the picture here, they typically sit above either eyebrow, but they can be stacked on top of each other if you're feeling discomfort. So be careful not to place the pads on the temples. Now, what I mean by this is when you're putting one of these pads on, and let's see if I can open up this packet here. So when you're putting one of these pads on, you got to be wary about where you're placing it. If you place it too close here and it's sitting on your temple, it's going to be uncomfortable. Make sure you're putting it kind of closer in here. Now, these are longer pads. So one thing you can do is you can take scissors, you can take the pad, and you can cut, and you can trim these down. You'll see the area on the pad to where the wire goes. Don't cut it that short, but as long as you're not cutting through the individual pad wire, you're going to be fine to be able to shorten those to make them more comfortable. In the cases of people that find that doing the PTSD protocol gives them a headache, you can absolutely stack these on your forehead. So it's hard for me to do it without a mirror, but you can stack them, and obviously they're not going to be as far apart as I would normally like. But then you're not going to be getting as much discomfort from a sensitive trigeminal nerve. Okay. So be careful not to place the pad on those temples and trim them if you need to. The next thing I want to cover is the third eye pad, which is a relatively new pad. These pads do what they say in the name. They kind of sit on the third eye. They allow you to treat the third eye area itself, typically with gamma waves, which is your 32 to 45 hertz. This is not effective, or as effective, I should say, for chakras as we might like. So people may think, oh, I'm going to use this to treat my third eye chakra. But it's not really getting through to the back where the chakras are situated. So it's not as effective, but it is an excellent alternative to the trigeminal pads for the PTSD and anxiety and depression protocol, because it kind of does that whole sitting right on your forehead thing that we're trying to do with the trigeminals for people that are sensitive. You can just place this small little one right here on your third eye, and then the wires can be draped over behind your ears, and you won't even really notice the issue going on with any discomfort whatsoever. So that one is well worth looking at as well. And then next, the lower back pad. So this is probably one of the most popular pads, and this is because it's so big. As I mentioned before, I showed it before. It's quite big, and it has a gap for your spinal cord, so it prevents you from crossing the spine directly. So when you're dealing with a backache, you can just stick it on your back, and it will treat either side. Now, I've also seen these pads used on the shoulders, the abdomen, and more, as they cover a large surface area. You can have this kind of flat over the front and back of your shoulder. You can have it across your abdomen, etc. It's very sticky. It's a good pad, though. It covers a very large surface area. The next thing to cover is the exercise programs. So these can be important for pad placement as well. How and where are you going to place these? So if you have the exercise programs in the Life Pinnacle or the Pro Sport 3, you can use the conductive pads to physically exercise and strengthen muscle groups. So in these cases, it's going to depend on the muscle group at hand. And I do recommend looking up the muscle groups. So try and look up pictures of them so you can get an idea of where it will be. You can see an example picture here. We're placing at the beginning and end of a muscle group to exercise that particular group. And then lastly, the only other thing that really differs with conductive pads is the trigger points area. Now, each of your device manuals is going to contain pages of trigger points at the back, and you can use these to determine areas of inflammation versus their source. So it's really, really simple. You simply want to place one pad on the trigger point, marked as the black X, and the other on your highest area of pain that is not that black X. Maintaining a 1-inch minimum distance between the pads as you can. So that is it for our pad placement little presentation here for our 10-minute training. There's some nuances to conductive pads, but realistically, it's just about placing them on the body and using them and not neglecting the importance of active treatment. Make sure you do your active treatment first, because even 3 to 5 minutes of active treatment is going to make a big difference when it comes to effectively treating with passive treatment. So thank you all for joining me, and I will see you next week for another Monday 10-minute training.